Thank you very much for joining us, and welcome to another part of our series of Doctor-Innovator-Journey stories. Today we have the pleasure of having Dr. James Skinovsky. Dr. Skinovsky is not only a world-renowned surgeon with a lot of firsts in surgical techniques, but also a Doctor-Innovator-Facilitator in digital surgery. Dr. Skinovsky has been involved in health tech for some 20 years. He's really a pioneer that developed many of the health technology solutions and platforms in Brazil with very limited resources. And he founded the High Tech Surgery Association, where he is now the president. And many firsts, as I mentioned, such as the first surgeon in the world to develop a single port surgery platform back in 2016, and the first multi-center study dedicated to the application, and also developed and created the Surgical Innovation Journal, and is currently working on developing a new digital surgery journal that will be out in the next few months. Dr. Skinovsky has been involved in robotic surgery, high-tech surgery, virtual reality, and remote medicine, and many other digital health technologies and high-tech solutions. Dr. Skinovsky, thank you. I see you're in the OR, the operating room. I know you're a very busy surgeon, so thank you for taking the time to meet us today from the OR. May I ask you, Dr. Skinovsky, to please just kind of share your story as a doctor innovator. What got you started? Why did you feel the need to go down this path? And just please share your story as a doctor innovator with us. Thank you.
Hello, dear friends. Hello, dear friends from TAMP. Hello, dear David. Hello, dear friends from HTC. Well, I had started in using these new technologies and new approaches in the health area, especially in the surgical field, because my natural curiosity and because I'm fascinated of the appliance of these new technologies, these new resources, and how to use them to get better our relationship with our patients, our care with our populations, and our advance as a person and as a professional. I think it's very important because we have to stay in the wave of innovation, and it's quite important, especially because of this item that I've told you how to benefit more our patients, our populations, and above all, and also how to benefit ourselves, how to feel better with our professional, with our daily activities and our daily profession.
Wow, that's fascinating, Dr. Skinovsky. Thank you very much for sharing that. If I understand you correctly, you're saying that it begins with the desire, begins with the curiosity. So the innovative mindset, and by pursuing this journey as a doctor innovator, we can benefit our patients, benefit the population, and benefit ourselves, and as you mentioned, stay in the wave or ride the wave of innovation. I'd like to move now to asking you, what, based on your knowledge, skills, and experience, your journey as a doctor innovator, what suggestions, what advice would you give to your doctor peers around the world that are maybe just beginning this journey, or even have advanced in their journey as a doctor innovator?
Well, about my recommendations and suggestions for the the new, for the beginners, the colleagues that want to enter in this revolutionary field of the health community, of the surgery, is to look for courses, programs, fellowships that brings you to have contact with professors, professionals that are that are pushing these new approaches and technologies. Don't give up. Follow step by step, always forward. Okay.
Well, that's wonderful advice, Dr. Skinovsky. Just to take the first step, you're suggesting to your doctor peers, your surgeon peers around the world to move forward, to not give up, just step by step, to enter into the world of digital health technology, digital surgery, and the other emerging technologies, and just, as you say, to step forward. I think that is really great advice. And so now I'd like to finish by asking you, your thoughts on the near future, or we're in the emerging future now. We like to say it's happening now. But where do you see emerging technology and high-tech surgery and digital surgery, all the things you're involved in and leading? Where do you see that going now and in the very near future?
About how I have seen the future, not just the very far future, but the upcoming future. The present that we can find already steps of the so-called future. Today we are using robots, single port surgery, digital technologies, not just for training, but in our surgeries too. We have a lot of new technologies that are coming and integrating yourselves in our daily practice, as the 3D printers, the augmented reality, the virtual reality, and also the new robotic platforms. Simple ones, smaller and easy to handle. So in the next future, the millibots, or very, very small robots that are acting inside our body with less than 1 millimeter. So we have to learn how to use the big data and all these technologies in our daily practice. This is the challenge, and a very important challenge.
Wonderful, Dr. Skinovsky. Thank you so much for sharing that. Your expertise in digital health and talking about bots and big data and the need to use that and you emphasize for doctors to use that in their daily practice. So, immediate application and real life experiences, real world applications that are immediately applicable. So I think that sounds like a wonderful future, that we're leveraging technology to improve patient care, to improve delivery and outcomes. So I know you're very busy, so I'm just going to go ahead and sign off. I'll say goodbye to you now, and thank you very much for joining us, and we look forward to continuing to work with you and to have you back on the show to talk more later. Thank you, Dr. Skinovsky, and thank you for your service. Thank you, everyone here, for joining us. We appreciate you coming in and learning more about the doctor innovators, listening to their stories as doctor innovators, their journey, and we appreciate your support. And we love to have you to continue to listen. So thank you.